But I know Dr. Jorgensen made a big point about that.
So just so I'm mindful of your time, what time do you need to leave so that way I
I've
can.
got I've got 10 minutes.
All right. So I'm going to ask you just a couple quick questions. I'll put them together
Please.
and then I'll
Great.
have let the audience take the remainder of the time.
That's fine.
So, what do you do if you had your wisdom teeth out, and how do you prevent getting the impacted wisdom teeth in the first place? Why do we have that? And I'm gonna throw a few at you, and then causes of receding gums. And I know they do bonding to cover up the recession sometimes. Is that a good solution to resolving that, or is there a way to naturally have your gums unrecede, I guess?
Yes. And those are great questions. So
Yes.
quickly, let's talk about the wisdom teeth.
Yes.
Wisdom teeth, in my opinion, everyone needs a 3D cone beam. So the idea and what really the approach now, especially with children, is expanding the growth and development of the human jaw when you're young. So guided eruption. There are products like MyoBrace and other things that help with creating the growth and development that's necessary to accommodate the teeth. Way too many wisdom teeth don't need to come out if they were guided and there was the proper oversight and direction at an early age. But too often, dentists wait for the wisdom teeth to come in, and they're coming in like this, sideways, or like this, or like this, or like this. And those malpositioned wisdom teeth can be a problem. So, number two, if you have an impaction that could be damaging the other tooth from a wisdom tooth, you want to make sure that if it is surgically removed, you need to have it done biologically, where there is a grafting and a proper treatment of the remaining bone so that that area regenerates and heals, and you do not get a cavitation. And number three is the fact that a 3D cone beam, um, even in the mid-teen or early teen years, can be helpful in identifying the proper growth pattern of even a panoramic film is helpful, but 3D gives us much more information. So that's about the wisdom teeth. The second part of your question was about gum recession, I think, right?
Yes. Yes. And then
Um,
bonding
three,
yeah.
yeah, three causes of gum recession. Okay. First cause, believe it or not, actually, I can put four causes. First cause is gum disease. People smile, they look in the mirror and they're like, oh my God, my gums are up here. What happened? My gums receded. No, the gums didn't recede. You had undiagnosed and untreated gum disease that caused the bone to resorb, and the gums follow the bone resorption. So you're losing bone around your teeth. And if you have gum recession from periodontal disease, that's serious. The second reason why there's gum recession is you have people that, if your teeth do not hit properly, like in other words, the teeth should hit like this and they hit like this, and you have something called a bad bite or malocclusion, that can cause the formation of what's called abfractions. That's ABFRACTION. Abfraction or abfractions are caused by bad occlusion. So get your bite, do an Invisalign, get your bite better aligned. You will stop the recession. Third, am I up to number three? I think I'm up to
Yes.
number three. Um, Parasites. Parasites can affect at the gum line. So sometimes we look at that and dysbiosis. I see that more in people who are immunocompromised and people who may have jaw cavitations. They can also have parasitic activity. Interesting, kind of freaked me out. Really wasn't taught that in dental school. Um, and then the fourth reason why you get gum recession is people have a hard toothbrush. These are the people who want to scrub the hell out of their gums. They're brushing improperly and they're going like this. But most of the time, the dentist doesn't even look at the other three reasons. They're like, oh, you're brushing too hard. That's why you got the gum recession up here. Using a hard toothbrush, you're brushing incorrectly. Believe it or not, that's probably the fourth reason. But in terms of bonding these areas, there's a couple of different ways you can deal with recession. It really deals with the amount. There's something called a pinhole technique that some people are a candidate for. It was developed by a periodontist, where you can actually lift the drape of the gum over the recession so the teeth will appear better, and you can get readhesion of the soft tissue. Need to be healthy. You could look at that as an option. A lot of people are not options for that. So bonding composite resin, if it's BPA free, that's one way. Some people do porcelain veneers. Some people do nothing, but sometimes when you realign the teeth, you actually get reattachment of periodontal tissue. So I've actually seen that, where when the tooth is like this, the gum's up here, and when you move the tooth into proper position, you can get a return of proper periodontal tissue at the cervical margin, the gum margin of the tooth.
So that would be the only way, is it to realign your teeth? It doesn't. There's no way to have it
realign the teeth. You want to check and see if you have parasites too. So you really want to stop that. I mean, gum recession is an annoyance. It can be an aesthetic issue and all that. The important thing is that if the recession is significant and the teeth are sensitive, one of the things that I use in my practice is ozone. Ozone sclerosis or seals the dental tubules, so teeth become less sensitive. Every dentist should use dental ozone. It's a wonderful, wonderful treatment.
Okay, so we just have a couple minutes. I'm going to throw it out to
Sure.
the audience here. So Dave Ross, state where you're from and ask your question. Dave? Okay, moving on to the next person. Ruth L, state where you're from and ask your question. There you go.
Hi.
State where you're from and ask your question.
Ruth.
I'm from Toronto, Canada. And I had a tooth fall out, my front tooth. And fortunately, I kept the tooth and the dentist was able to glue it back in, but I do need to have an implant. And I was listening last night to you, but I didn't get what you suggested for whether you were against the metal, the titanium.
Yes.
What would be a good
excellent question. Excellent question. No one should put metal in their mouth. Titanium implants, and I had 3, were found to be inflammatory. They do endotoxin. So what you should have, zirconium. Zirconium is really the gold standard now for non-metallic implants. Most of them have come out of Switzerland, but zirconia implants actually are not inflammatory to the human body. So the bone that grows around a zirconia implant is vascular bone. It has a blood supply. Bone around titanium implants is like scar tissue bone. It's called sclerotic bone. That's the difference. So thank you for asking that question. And find a dentist that is competent in doing zirconia implants.
Thank you.
You're welcome.
Thank you. Do you have time for one more question?
Sure.
All right. So we're going to go to Marta V. State where you're from and ask your question. Marta. Oh, we're not having a lot of luck here. Marta.
We lost him.
Let's see here. All right. Now we're going to go to Shelly. We're playing here. Go ahead.
Hi, Shelly.
Hi, can you hear me?
Yes.
Hi, apologies. I've just actually logged in. I'm in the UK, so I've just only got chance this evening. So apologies if I'm asking a question you've already addressed. But I wanted to say there's a trend for hydroxylapatite toothpastes at the moment. I don't feel that that's the correct thing to do. Would you agree? And if so, why?
Yes. And you know what? I did speak a little about that. I talked about nanohydroxyapatite actually being harmful to the soft tissue in the mouth. And also the fact that, putting minerals in, micro hydroxyapatite is fine. I actually use ionic minerals alone. So hydroxyapatite is the mineral that your teeth and bones are made of. The problem is a lot of it is synthetic. It's made in a lab. And nanohydroxyapatite was actually developed by NASA in the 1970s. So microparticle, okay. Nanoparticle, not okay. So look on the tube. If it says nanohydroxyapatite, it's a big craze right now. It's another fad. The reality is, what I was explaining is that when the oral microbiome is in balance, you don't need any of this garbage. You can actually, as long as the microbiome is healthy and robust, it transports minerals, ionic minerals from saliva. ionic calcium and phosphorus, which makes hydroxyapatite and helps to remineralize your teeth naturally. But that's what happens when the oral microbiome, this microflora of the mouth, is in balance. When it's out of balance, you actually get demineralization. So you get the opposite effect. So we've looked at this. I've done a lot of research. It's called the dental cyalomicrobial complex. And a lot of good oral microbiome research came out of the UK, by the way, in Birmingham.
Okay.
And Leeds. So,
Okay.
yeah. So anyway.
Great.
Go ahead.
Thank you. Thank you very much for that. So, do you have time for one more really quick question?
Let's do one more. Sure, one more. I
All
feel
right.
bad.
I'm going to throw it back to Dave
I'm
Frost.
in the airport lounge.
All right, Dave.
hi.
I'm giving you another chance.
Yeah,
Just
hi. Thank you
ask
so much.
questions.
I'm Dave from Massachusetts. I have just quick questions. What
Sure.
you thought about Ionic toothbrush, water floss, and chewing sugar-free gum, sorbitol gum after meals? Thank you.
First two I love. Ionic toothbrush, great. Water flossing, I recommend them. I have them in my office. Water flossers do a really good thing. They help to eliminate food, plaque, and debris that's especially interproximally with teeth. A lot of people have trouble flossing. Water flossing can be really helpful. Another thing that water flossing does, the other thing that I like, is the hydromassage and the microcirculation of the gums. The third thing, sorbitol is another sugar alcohol, along with xylitol and erythritol. All of the sugar alcohols, sorbitol is probably less damaging than xylitol, which is not absorbed or metabolized. Erythritol is the worst of the bunch. Erythritol is absorbed, but not metabolized, so it stays in blood plasma. It's been linked to thrombocytic clots. There was a big study that came out last summer about heart attacks and strokes from high plasma levels of erythritol. Blood plasma levels. All righty.
That was a very good speed round of those questions. So thank you so much. We'll make sure that we end it now so you can catch your plane.
Thank you.
If we can unmute the audience real quickly so they can share their appreciation for the doctor.
Let's do that.
Thank you so much.
So much.
95 miles a
Thank you.
gallon.
Safe
Thank
travels.
you. Thank you.
Yeah, so just